hospitals aren't full of COVID patients like they were back in December and January. The hospitals are very full just in general because of taking care of patients that need other care. But we are seeing this proportion of patients with COVID-19 growing in our hospitals.
I think the summer is known as like the 100 deadliest days of summer for trauma events typically. So that kind of correlates with that increase too. But like you said, an increase in the hospital though, either way is not great for caregivers who have been going through this for the last almost 2 years now, which is crazy. And on that note, you kind of mentioned this, but do you know the percentage of people who are currently hospitalized who are vaccinated versus unvaccinated?
Yeah, so when we looked at, all those COVID-19 patients in our hospital recently, the past couple of months, less than 5% of them that are admitted for COVID-19 have been fully vaccinated. And so, the other way to say that is, 95% of those hospitalizations for COVID-19 are in the unvaccinated population. We continue to show that these vaccines, the Pfizer, the Moderna vaccine, J&J vaccine, are just incredibly effective at reducing the risk of hospitalization and death due to COVID-19.
And after last week's surge and warnings from doctors to get vaccinated, has there been any rise in vaccination numbers at all? I know that we were kind of stagnant for the last couple of weeks. Did we see a spike at all in people going to get vaccines?
When we look at the Utah Department of Health website and we look at the number of vaccinations given per day, what you can see is just this really stabilizing plateau of relatively low numbers of vaccinations. So we're still getting vaccinations out to our communities, but at much lower levels of vaccines that were previously given. We have not seen a significant uptick in vaccinations yet.
And there's been a lot of conversations too with people who are not vaccinated, who maybe have had COVID in the past, that aren't sure about this piece between natural immunization and actually getting the vaccine itself. Can you kind of talk about what the difference is between the two and what is almost better to have?
Yeah, that's a great topic to chat about. It's, how protected are you from a natural infection with COVID-19? Let's say you take somebody who had COVID a year ago. How protected are they compared to somebody that didn't have natural infection but got the immunization? And so there's a couple of things to kind of digest there. One is when you look at those that are infected with COVID-19, the body's immune response to that infection is incredibly variable. And so when we look at these groups of patients that have had natural infections, we see some people that have really high level antibody response. We see some people with really high, what we call T cell response, this kind of other arm of the immune system, and people that really reacted well to that infection. Then you see other people that have no antibody response or no T cell response, and you see this really variability in how people respond to this infection. That variability leads to then variability of risk for reinfection. And so contrast that with the vaccination. When we give a vaccination and we follow those vaccine cohorts out, we see a much more reliable response from the body's immune system, both from a B cell, making antibodies, and also this other arm, this T cell. And so we know that the vaccination leads to much more reliable vaccine response as compared to natural infection. And we anticipate it's going to lead to a much more durable response, meaning it's going to last longer. And then there's also data to suggest that people that have been vaccinated against this spike protein as compared to natural infection likely is going to have more protection against these variants that we see, Delta, Lambda, all the different variants that we have seen. So that's kind of where we're at. The science is pointing us to the fact that vaccination is likely going to be more durable and also more likely able to defend against variants. That said, when we look at natural infection and with the studies that we have, or follow these cohorts, so that, they have pretty good protection for about 8 months. We don't have anything past that, and we don't have any good data about how natural infection has done against the variants, particularly Delta variant. And so what we say is that people that have been infected with COVID-19 in the past, it's absolutely important to get vaccinated against COVID-19, because you're going to have a stronger response and be more protected.
What if you've had COVID-19? Would only getting one dose of the vaccine, so just the first of Pfizer or first of Moderna, be enough to prevent from future infections? I've actually heard people personally talk about this, where their doctors have said, maybe you should look into this. Is this something that people are looking at?
Yeah, we're definitely looking at it, and it very well could be the case that you only need one shot after after a natural infection. That said, we don't have any clinical data to show that that's effective. What we have is data in the laboratory that shows that people have been infected with COVID-19, gets one shot, then their antibody levels after that one shot is comparable to those that had no prior infection and two shots of the vaccine. And so we have laboratory data to say that they're comparable, but we don't have any clinical data to suggest that their risk of infection or reinfection in this case is the same as those that have been vaccinated with two doses. So I think the science is getting there, but before we would make this recommendation, and CDC hasn't made this recommendation as well, before we'd make that recommendation, we'd really want to know that there is clinical protection. We don't know that yet. And then the other challenge you have is that, do you have that same response in people that were asymptomatically infected with COVID? Asymptomatically infected with COVID probably don't have as much immune response, so then one dose of the vaccine may not work as well. So then you get into this variability of, well, what was your first infection like? And was that enough to kind of prime the immune system? And so, at this point, there's too many questions circling around this topic that we just would say absolutely get your 2-dose series as planned if you've had previous infection.
Someone else just asked a question around that vaccinated population in our hospitals. Is that 5% figure for vaccinated individuals who are admitted to our hospital higher or lower than before the Delta variant existed? And have you noticed more breakthrough cases with hospitalization for any particular brand of vaccine as well?
Really good question. And, the Delta variant really kind of hit Utah in kind of early May and really ramped up. And now it's a dominant virus. And now we're seeing hospitalizations go up compared to the number of hospitalizations that we had back in December and January. Our hospitalization numbers are really low right now. And so what the question is asking is, what is the vaccine effectiveness against the Delta variant in terms of hospitalization, death, ICU status, admission to the hospital, ED, urgent care, et cetera? We don't have enough data yet. We don't have enough data endpoints to be able to answer that question here using our US-based data. There's going to be a couple things surrounding that question that's going to be tough to tease out. It's going to be waning immunity from the vaccine. Is that the issue? Or is it that we're seeing a Delta variant that's going to make the vaccine less effective? And so we're going to have to try to tease that apart. What we're seeing right now is that the percent that have been previously vaccinated in the hospital has stayed steady at about 5%, even as we see the epidemiology of the COVID-19 virus change. Okay, so what we're not seeing is this big spike in percent vaccinated currently, which is a good sign to us saying that this vaccine protects well against severe infection for Delta.
Along those same lines too, have symptoms of COVID changed at all with the new variants? Is there anything else that providers are starting to look at when someone presents with symptoms that could potentially be COVID-19?
Yeah, so what's being reported and not necessarily validated in the medical literature is that more people are seeing that COVID-19 is being it's resulting in just common cold symptoms. Sore throat, runny nose, not as much cough, high fever, et cetera. And some people are saying that that's due to a different presentation of the Delta variant. Okay, so that could be, and that's something that definitely warrants evaluation. I would also say that we saw a lot of people in the winter have those same symptoms and have COVID-19. And so we're trying to tease that apart. And the other thing that is something we have to consider is that previously, when we were looking at symptoms of COVID-19, it was the elderly population that was getting infected and having really severe symptoms from it. Now, that elderly population is very well vaccinated. 80% plus of our elderly is vaccinated. So we've shifted the population getting infected now to this younger age group, this 25 to 60-year-old age group. And so are we seeing that the symptoms are different because of the Delta variant, or are we seeing that symptoms are different because it's the shifting in the age group that's predominantly getting infected? So that being said, it's going to be, tough to tease out. I would say that COVID-19 is an upper respiratory infection, period. So if you have signs and symptoms of a cold, that could be COVID-19, and that should warrant a test. And so it is possible that we're seeing kind of an evolution of symptoms due to a change in variant, but it is also possible just seeing the difference in symptoms based on age, and that if you have those symptoms, it's absolutely imperative to get tested.
What about pediatric patients? Are we seeing an increase of any of those people getting the Delta variant at all, or any increase in children for hospitalizations, especially those who can't get vaccinated? And second part to that, what do you suggest on how to keep children safe as school strangely starts in like about a month? So how do we start keeping kids safe again as we go back to school as well?
Right. When you look at the demographics of COVID-19 across Utah, you do see, an uptick in that 15 to 24-year-old age group, a milder uptick in that 1 to 14-year-old age group. And obviously, when you look at vaccination status of the younger population is least likely to be vaccinated, especially the 12 and ups. And we haven't got approval for the younger folks. We have not seen a big increase in hospitalizations at primary children's due to COVID-19, fortunately. There was a time in the past couple of months where they had no patients in the hospital with COVID-19, which was amazing. And now we see a couple, but not this huge spike. But when you do look at the data of individual people getting infected across our communities, that 15 to 24-year-old age group is increasing. But we're also seeing increases across other ages as well. So when you ask about how to keep people safe going back to school, if they're eligible for a vaccine, get vaccinated. I mean, that's the simplest kind of approach. And then, we're obviously going to be looking at making sure that if students have signs and symptoms of COVID-19, that they don't go to school, that they stay home and look at alternative options. We're really going to be focusing on testing, making sure that we can test people that have symptoms. And then we'll be obviously looking to our school districts to look at what type of interventions they're going to put in place in the classroom to ensure our kids are safe, especially in the 12 and under that aren't eligible for the vaccine as of yet.
Another question we just got was around if vaccinated people can transmit the virus, which you kind of mentioned that we are seeing vaccinated people, very small percentage in our hospitals. Why can they transmit the virus potentially? And what does this mean for someone who's vaccinated versus unvaccinated, especially with most people not wearing masks if they're vaccinated at this point? And could this hinder the state's progress in actually reaching herd immunity if there's still vaccinated people getting COVID-19?
Yeah, so keep in mind the vaccine isn't 100% effective at sterilizing immunity. When you look at the studies in terms of symptomatic infection, it's between about 85 and 95% effective. And so that certainly leaves people that can get infected even if they've had the vaccine. And then when you look at the effectiveness of the vaccine in preventing infection, not necessarily disease or symptomatic illness, but actually just getting infected asymptomatically, it's still very good, but it's not 100%. And so there's certainly going to be people that are vaccinated that get infection that could very well transmit the infection. Absolutely. In those people that get infected after vaccination, what we expect to see and what we're seeing in the literature is that disease is what we call attenuated, meaning that it's not as severe as it would have been if they hadn't been vaccinated. That said, if they have active infection, they can transmit the virus. The other thing that we're seeing in the literature is that people that do get infected after vaccination have lower viral burdens, in their upper respiratory tract, which likely is going to lead to less transmission, not no transmission, but less transmission. And so we do think that vaccination is going to absolutely slow that transmission because it prevents infection, and it also probably will slow transmission due to decreased viral burdens that we see in our patients. And I forgot the second half of the question. Something about herd
Sorry,
immunity.
it was a lot. The last one was, do you feel like asymptomatic individuals could hinder the state's progress in reaching herd immunity potentially?
Yeah, I think, this idea about herd immunity, and we've talked about this before, and Amanda, my feelings about this, is that we should not be focusing on herd immunity. Herd immunity, will occur when we have our population that is no longer susceptible to this infection. And so that is going to be, at estimates of between 70 to 75% of our community is not susceptible to this infection. That includes kids, that includes everybody. In addition, we also don't know whether or not herd immunity is feasible. Herd immunity occurs when you have long-lasting protection. You think about, you get a vaccine and you're protected for 10 years. We don't have herd immunity against influenza. Right? Influenza changes from year to year. We have a vaccine that's effective in reducing severe illness, but that virus is constantly changing, which allows our communities to remain susceptible. And so they have to get vaccines every year. And so that may be the case for COVID-19, and the fact that we're seeing this vaccine or this virus change. We now have Lambda. That's going to be a continuous issue with this. And so whether or not herd immunity is even feasible, I think, is a big question. And I think what we have to realize is that the more and more that our community gets vaccinated, the less transmission we're going to have. And that's going to be a huge benefit to our public health, population health, to our hospitals, to the health of our citizens. But it may not eliminate COVID-19. I feel like COVID-19 is going to be with us, for the years to come. And vaccination is going to be the way that we can prevent really severe disease from this.
Let's talk about the variants a little bit more. You mentioned the Lambda variant. How long has that variant been around? And do we know anything around if it's more transmissible, if it has a higher death rate? Is there anything that the public should be concerned about for this specific variant?
Yeah, so Lambda is coming out of South America. It's been highlighted in Peru now since May. We know very little about the transmissibility, the severity, the lethality, and whether or not this escapes our current vaccines. There was just a report published on the preprint servers that shows that people that have been vaccinated do have in their bloodstream the ability to target that particular variant. We haven't seen that in any kind of clinical data. So the first glimpse we have at this is kind of like Delta, where we say, okay, our vaccine is likely going to cover it, but we don't have definitive data on it. And so this is very early in terms of looking at outcomes due to Lambda, and particularly how well our vaccines cover it. We're obviously going to learn more, just like we have with Delta. But I think it really highlights something that just deserves mentioning, is that this is just a great example of how global health can impact our individual Utah public health. And so as long as we still have countries in the world that are poorly vaccinated, that has high rates of viral transmission, we're going to have the development of variants. And those variants can very well come to us here in Utah and cause issues. Just look at the Delta variant, look at Alpha variant, those things came from different countries, came to the US, and now it's the dominant virus. And so as long as there's ongoing high rates of viral transmission across the world, we're going to see those variants hitting Utah. And we've already seen Lambda, in the United States. And so it just is another example why it's so important that vaccines get distributed throughout the world, and make sure that we get all of our communities across the globe vaccinated, because if we don't, we're going to continue seeing variants hitting Utah.
Someone asked a really interesting question. They said, because Lambda was first found in Peru, is it likely to be more dangerous to people in Utah because of the altitude? Do you know anything about that?
No, I know zero about that.
It's an interesting question, though. So I want to talk about boosters really quick. We've had a lot of questions around boosters. The first one I just want to touch on is, Fauci and the CDC came out with their recommendations. Israel is currently doing something different where they are allowing people to get a third boost if they are immunocompromised people. What are your recommendations? What are we seeing as far as boosters go? Is it something that we're going to need soon? Anything you want to give us on that?
Yeah, so there's two reasons why you'd get a booster, and we'll just come back to this. So one, you'd get a booster because your immunity is waning. You got the vaccine and now your immunity wanes and you need to boost your immunity to maintain a certain threshold. We don't know what that threshold is, but whatever that threshold is, that's why you'd get a booster, is to boost your immunity back up. And you'd use the same vaccine that you got previously. So that's the first reason. The second reason to get a booster is if there is a new variant that evades the response of the vaccine. And so you need essentially new immunity. And so then you give a booster, let's say now with the sequence of the Delta variant spike protein. And so now you're getting new immunity. So those are the two reasons why you would need a booster. And so the first one, waning immunity. We haven't seen any evidence that the vaccine is waning in an effectiveness over time. And so this is something that's going to be followed through these big clinical trials done by Pfizer, Moderna, and J&J. Keep in mind, they follow those patients out for 2 years. And so they're looking at those people that got vaccinated. And now everybody in those vaccine trials are vaccinated. They're looking at when do they start seeing infections in those people, because that's an indication of waning immunity. We can do the same thing in our population-based data sets. And we're looking at, okay, when do we start seeing people get infected? Because that's an indication of waning immunity. We haven't seen that yet. Okay, so from that standpoint, we don't need boosters. Delta variant seems to be well covered by our vaccine, and in particular, preventing severe infection and hospitalization. So we haven't seen that yet either. And so we really are going to have to be dependent on this, allowing the science to drive when boosters are going to be needed. Will boosters be needed? Probably, eventually. Do we know if they're going to be needed by fall? Nope. And I suspect that we're going to get more information on that. But right now, there's no evidence that we need booster shots. And I would probably argue that where would those booster shots be better utilized? Would they be better utilized in the United States, or would they be better utilized across the globe to make sure that we get everybody vaccinated so we prevent the development of variants? As of right now, we don't see evidence that booster shots are needed. CDC, FDA is working with our pharmaceutical partners to evaluate this. But at this point, I think we're watching and we're waiting and we're seeing how the data plays out.
Are physicians or are you worried at all about this messaging about the variants and vaccines kind of being lost on Utahns? It does seem like we've put the entire pandemic behind us. Things are opened back up. People are doing pretty much their normal lives at this point. Are people worried at all that they're not going to get vaccinated or things could potentially get worse because of the actions and behaviors people are exhibiting now?
Yeah, that's a tough question, Amanda. I think what is happening is that the Delta variant is very transmissible and it can cause more severe disease than our previous variants or previous viruses. That virus will find our portions of the community that are not vaccinated. Okay, and so we will see, kind of dense transmission with Delta variant in pockets of the community that are poorly vaccinated. And that's going to be more efficient because of the fact that we are no longer kind of really following public health measures in terms of masking and social distancing, et cetera. And so, what our current behaviors are doing is allowing Delta variant to really transmit through unvaccinated populations. And that's what's driving increased cases, and that's what's driving our increased hospitalizations. And so what has happened, not just in Utah, but across the US, is a shift from public health to individualized risk reduction strategies. So that's a mouthful. But originally we're saying, okay, this is public health. We're going to wear masks. We're going to socially distance. We're going to limit our contacts because we want to prevent the transmission of this virus. And now we've pivoted to say, we now have a tool that allows you to be protected against severe disease and even not severe disease, and that's vaccination. And so it is now your personal choice to get vaccinated or not. And if you get vaccinated, you don't necessarily need to follow those strict or public health precautions, but it's your choice. And what we're seeing now is that in those that choose not to get vaccinated, they're the ones at risk for severe disease. And their actions are going to then determine whether or not they're going to be at higher risk or lower risk of getting the infection.
Another question that we received is around the wildfire smoke. And I feel like you addressed this last year too, because there were lots of fires last year as well. But is there any link between the smoke and COVID-19 symptoms? Could it potentially make it worse on someone who contracts COVID-19?
It potentially could, especially those that have underlying lung disease. So people with underlying COPD have higher rates of exacerbations. And then if a concomitant COVID-19 infection were to occur during the same time, you potentially could hypothesize that you'd have a worse outcome. Maybe something where you could have managed at home, but now you're actually going to have to manage in the hospital because of kind of two hits in terms of the wildfire smoke and COVID-19. So I could definitely see that for sure, especially in those high risk susceptible individuals.
There's also been this question, which has been asked a few times to different people, but have we seen any deaths that have been directly correlated to the vaccines here in Utah, or if you have any national data as well?
No, I haven't heard of any deaths associated with the vaccines at all.
And I think it's important to mention on that the reporting system where you can report severe reactions or any sort of side effects is self-reporting. So can you just mention kind of how the CDC, if they do, goes back and maybe checks those out or says, because I know we've seen people reporting that they have reported someone dying from the vaccine, but can you kind of explain how that works?
Yeah, so the CDC has a reporting system called VAERS, which allows clinicians and also a self-reporting strategy to report, severe side effects due to the vaccine. And so, clinicians report in cases of myocarditis. They're reporting cases of clotting, and that's how we found this association with our vaccines with myocarditis and also this clotting. And that system works. It works because I can say that it's because we found these very rare associations through this reporting system. And so we are getting people reporting into this. We are finding these very rare kind of needle in the haystack correlations with our vaccinations. And that's a really good thing, right? That's the safety mechanisms that make sure that these vaccines are safe and effective. And there's been a lot of attention focused on it. And so that's the way they can assess deaths. And so clinicians report in. Obviously, you can't self-report a death if you've died, right? But clinicians can. And there's been a big focus across Intermountain and across all healthcare organizations to report in any side effects that could be related to vaccination, death obviously being one of them. And we have not seen, any significant association with vaccination and death. And I would say that when you look at adverse events due to vaccines, they always fall in that first 2 months post-vaccine. And so we don't have, any kind of history of long-term side effects from vaccination. Those adverse events occur in the first 2 months after vaccination. And so by now, after millions and millions of doses have been given, we would have seen that association by now.
Is there any last messages that you'd like to give before we take off for the day around vaccines or just COVID-19 in general?
Yeah, I think there's a lot of talks of variants. There's a lot of talks of boosters. There's, all of these kind of lines of conversation that can get people confused. And our continued focus needs to be just strictly on vaccination. There's always going to be variants. Lambda is now up. There's going to be another, variant after that, named after the Greek alphabet. There's going to be, further discussion about boosters, and there's going to be controversies about when to give boosters. But the main focus of protecting our communities and protecting individual health and public health is vaccination. And vaccines are safe. People say, oh, they haven't been, fully studied. And, I think that's a valid concern, and, one that we can speak to in the fact that when you compare the amount of research and attention that has been put on these vaccines over the past, now over a year, it just dwarfs the amount of research that has been put into influenza vaccines over the past 10 years. Okay, so the intensity and the scrutiny of the vaccines recently over the past year has just been incredible. And so, yes, it doesn't have full FDA approval. That is likely coming very, very soon. That being said, the amount of data that we have in terms of safety and efficacy and effectiveness just is incredible, and being generated at this rate that is, you can't compare it to anything else. And so, I just would say it is a time for us to reassure the public that these vaccines are scrutinized heavily, and that they are well studied, and that it is a safe vaccine, and it's very, very effective. We continue to learn more, and the more we learn, the more we're going to share. But let's not get distracted with variants. Let's not get distracted with boosters. Let's focus at the task at hand, and that task at hand is getting more people vaccinated.
Well, thank you for sharing all this great information. I think it's a great update for everyone to listen to. And if anyone watching has not been vaccinated yet and would like to find out where they can do so, you can go to intermountain.com/COVID vaccine. There is a list of resources that are available for vaccines, whether that's through a pharmacy, your doctor, or through state-run resources. Eddie, thank you again so much, and we will talk to everyone later. Thank you.
Thanks, Amanda. Happy birthday, by the way.
Thank you. That was off the live.
Thanks.
You were close. I recorded this, so I will send this over to Jess from our media team to send out to you guys. And thank you to everyone for saying happy birthday to me, and have a good day. Bye, everyone.
See ya.